Graves' disease is the very common cause of endogenous hyperthyroidism, and here you get TSH stimulating autoantibodies that are the predominant autoantibodies. Sometimes inhibitory autoantibodies may also be there, but most commonly you will get stimulatory and autoantibodies that are the predominant. So here you get a triad, you get a diffuse toxic goiter with signs of hyperthyroidism, all classical signs of hyperthyroidism, and you also get exophthalmos with proptosis, and there is a lid-like diplopia being the classical manifestation of ophthalmopathy, and also you get a pre-tibial myxedema with features of with the tibia showing myxedema may also be seen. So here these are the important features: triad of goiter, pretibial myxedema, and exophthalmos are the important feature. So here the patient may also land up in thyroid storm many a times, especially with some kind of a stress and particularly surgical procedures. There may be sudden increased release of thyroid hormones, and this Graves' disease is also associated with lots of other autoimmune conditions like Hashimoto's thyroiditis. It may be associated with myasthenia gravis, type 1 diabetes, and some pernicious anemia even. So family history is generally there, and here you get typically there is an increased goiter, there is increased thyroid follicular epithelial cell proliferation due to TSH autoantibodies. It basically accentuates the function of TSH receptor, TSH on TSH receptor. So TSH sensitivity increases, and that causes enhanced release of thyroid hormones. So that is the important feature. Pretibial myxedema is due to uh, increased dermal fibroblastic proliferation and glycosaminoglycans. And exophthalmos is due to increased fibroblastic proliferation, adipocytic differentiation, and also there is increased lymphocytic infiltrates in the retroorbital space that is being noted. So these are the important features, and the diagnosis typically involves the T3 T4 test. If you do, the free T3 T4 will be enhanced and TSH will be reduced. There will be follicular epithelial cells will be showing scalloping that will be noted, and thyroid in the biopsy you will see some kind of a scalloping. Apart from that, you will also see increased radioiodine uptake. In the scintigraphy studies, you will see that the radioiodine study is shows increased iodine uptake. That is the classical feature. And what you will do, how will you treat the patient? Treating with antithyroid drugs like propylthiouracil. Apart from that, radioiodine ablation study, and also some symptomatic management for that of the exophthalmos, that is decompression, and IV steroid may also be given. So these are the important things that are required for the treatment of Graves' disease. So apart from that, these patients are also having high incidences of HLA-DR3 and HLA-B8 association that is being noted in Graves' disease. And patients have typically, in the biopsy studies, you will see the papillary hyperplasia, papillary infoldings, scalloping, and resorption of colloids are typically noted. And as we discussed, there is increase T3 to free T3 T4 level, and with decreased TSH is the classical hallmark biochemical finding. And we discussed all the clinical features, the diagnostic modality, the pathogenesis. The pathogenesis here is the TSH receptor antibodies, this we discussed, though in some cases there may be inhibitory autoantibodies as well. And we also discussed the management, that is radioiodine ablation, antithyroid drugs, and decompression therapy for ophthalmopathy. So that's all for this short session of on the Graves' disease, which is a very important cause of endogenous hyperthyroidism. In fact, it is the most common cause of endogenous hyperthyroidism. And also, as we discussed, remember that it is associated commonly with that of lots of other autoimmune conditions like that of Hashimoto's, myasthenia gravis, pernicious anemia. Particularly family history of any of these may be present. Thank you for attending the session, and if you have any queries you can let me know, or you can message me, and you can put in the chat window regarding, you can put in the comment window regarding any queries you have regarding the Graves' disease. I will be happy to answer your questions. Thank you. I will be ending the session now.